I often hear that COVID-19 infection in children, no big deal. And while it's true that children tend to be less likely to have serious illness with COVID-19 compared to adults, it's not true for all kids. In the last couple of months, we've had tons of kids get infected with the Omicron variant. And while most kids had symptoms for a couple of days and then recovered, some of these kids got really sick enough to get to the hospital and need hospital admission. 1 in 100 to be exact. And of those kids that required hospital admission, 1 out of 10 required our highest level of care in the intensive care unit. When we looked at which child does need admission to the hospital for COVID-19 infection, we noticed a disproportionate amount of kids were either unvaccinated, were very young, so under age 2, kids who had other chronic medical conditions, and kids with other health disparities. Another thing to remember is that there are other rare but serious complications after COVID-19 infection, such as the multi-system inflammatory syndrome in children, also called MIS-C, and long COVID. So just remember, COVID-19 infection in kids, the risk is not zero.